So I think I just read the most exciting medication-related clinical study that I have ever read personally. So I'm going to do this reaction video about a medication called VERVE-102. I'm going to put the name on the screen right here. This is an investigational medication that Eli Lilly is actually looking into with Verve Therapeutics, I believe. In my opinion, this is without a doubt one of the most exciting things I think that I've ever read from a medical standpoint. So I have a few notes jotted down that I'm going to be reading to you guys about this trial, about this medication, and I'm just going to give you guys my genuine reaction to it. I've already read a little bit about it, but I don't know the full details. Some pretty exciting stuff though, to say the least. So let's dive into this. I don't have the full article in front of me, I just have the abstract, and we're going to get into this real quick, so follow along with me. So VERVE-102, like I just said, one of the most exciting medication developments when it comes to lipid management, because it aims to achieve permanent PCSK9 inhibition with a single treatment rather than requiring lifelong injections with a medication called a PCSK9 inhibitor. For example, that's Repatha. How this medication works. So VERVE-102 is an in vivo adenine base editing therapy. Let's stop right there. So in vivo means actually occurring inside a cell or in humans, right? It's an actual test. It's not just in a lab where we would call that in vitro. This is in vivo. Base editing therapy refers to gene therapy, right? Your DNA. So gene editing therapy. And this is after a one-time IV infusion, and it delivers, how it does this is it delivers mRNA encoding a base pair editor. And again, it's an adenine base editing therapy. It's a guide RNA that targets the PCSK9 gene. So that's our target here that this medication is working on, right? The therapy permanently disrupts the PCSK9 gene inside of liver cells, and that reduces the PCSK9 protein production. And when you have less PCSK9 protein, that means you have more LDL receptors that are available on the surface of liver cells called hepatocytes. When you have more LDL receptors available, they can grab more LDL cholesterol from the bloodstream. And what's that do? It lowers your LDL cholesterol. Why PCSK9 matters. So what researchers found 20 years ago is what this article talks about at the very beginning. People that are born with a naturally occurring loss of function PCSK9 mutation, they have three different things that I'm going to talk about. Number one is lower LDL cholesterol. They also have lower rates of something called ASCVD. That stands for atherosclerotic cardiovascular disease. And what exactly that refers to is a lower lifetime risk of things like heart attacks and strokes. VERVE-102, essentially what it does is it tries to recreate that genetic advantage. So it's kind of funny, it's ironic. That's a mutation. When somebody has a PCSK9 loss of function, that's a mutation, right? Because in a normal healthy human, that's ironic to say, but in a normal human, you have your PCSK9 gene functioning, right? If you have a loss of function, so a mutation, you actually get this genetic advantage of lower LDL and lower risk of heart attacks and strokes. That's crazy. The clinical trial just came out in May of this year, so just a few weeks ago. I'm a little late to the party on this. Some other people have talked about it, but it just happened. It's called the Heart-2, and it's a phase 1B trial. 35 patients that had familial hypercholesterolemia or premature coronary artery disease, they received the single infusion, this IV infusion of VERVE-102. What they found was that depending on the dose, I think it ranged from 0.3 milligrams per kilogram all the way up to 1 milligram per kilogram. What they found is that PCSK9 levels fell by anywhere from 51 to 88%, depending on that dose. Again, I just gave you that range. LDL cholesterol reductions, they were dose dependent. The highest dose cohort showed approximately 62% LDL reduction. So again, that's at that 1 milligram per kilogram dose. And the interesting thing is the effects, they remained observable for up to 18 months. So up to a year and a half. They still were seeing these effects in patients that followed along that long. That is just remarkable. One dose, one IV infusion. I don't know how long it took. I don't know the ins and outs of the IV infusion, but one dose, up to 60% LDL reduction. And it turns off your PCSK9 gene. Gene altering therapy. That is insane. We're living in the future, guys. We're here. We are here. Safety. Let's talk about safety. We've talked about the effectiveness. Let's go over safety. Reported adverse effects have been mild. So, main two things that we're seeing with this IV infusion. Number one is infusion-related reactions. When I hear that, I think of things like redness, maybe some irritation to that infusion site, maybe some minor swelling, but based on that commentary, I don't think anything big about just the infusion-related reaction. Something minor. And then a transient ALT elevation. That makes sense based on what we're actually working on in the body, which is the liver, which is where the PCSK9 gene, we're trying to turn that off in your liver cells. So if we see a little bit of a rise in the liver marker, the ALT lab, but then it goes back down, that's what transient means here. You know, that's not anything crazy to think about. And it goes back to normal. So no dose limiting toxicities were observed in this phase 1 study. So no patient actually said, hey, I can't tolerate this, I can't continue, I gotta quit. Nobody said that. They all were fine with that one infusion again. But man, this is potentially revolutionary for cardiovascular health. Currently, again, we have PCSK9 inhibitors like Repatha, and they work very well. You know, they do a great job of lowering LDL, but the problem with that is adherence is still an issue. And you would think, compared to something you have to take every day like a statin or ezetimibe, PCSK9 inhibitors, you actually get that injection every 2 weeks or every 4 weeks, depending on the dose that you get. But even that, people still struggle with adherence. This is just one dose, one IV infusion, VERVE-102, that could potentially provide one treatment, lifelong LDL reduction, and reduced cardiovascular risk without having to get doses over and over and over again. I'm just gonna say it. I think if larger trials can confirm and replicate both safety and the effectiveness, we might be onto something that is potentially fundamentally changing cardiovascular medicine, guys. This is incredible. I'm very interested to see where this goes. Again, it's only a phase 1B study, so very early on, only 35 patients, not near enough to actually say that we can use this long term. Very, very intriguing though. Very, very exciting to say the least. This is awesome right here. If you enjoyed this little walkthrough, again, this is just my reaction to this article, and I have some notes jotted down. I'm kind of reading off of them and talking to you guys at the same time. But man, if you enjoyed this, hit the like and subscribe button if you're not already. Share this with somebody you think would find this interesting, and tune in next because I have some other cool reaction videos coming.